Hi, Mr. Falkenberg. My name's Joanne. I'm a nurse practitioner student with Edinburgh and Clarion. If it's okay, I'd like to do a head-to-toe exam on you today.
Okay.
All right. So let me ask you a couple questions before we get started. To check for cranial nerve 1 olfactory, do you have any issues with your sense of smell at all?
No.
Any reproductive issues?
No.
And do you have to get up to go to the bathroom at night at all?
No.
Okay. So, starting head to toe, his head's normocephalic. There aren't really any bumps, lumps, anything like that. His skin's soft, pink, warm, dry. It looks fairly normal. We'll check his nose out first. It does look like he has a little bit of a deviated septum, probably broken before or something. Can I just have you tip your head back? Nares are patent bilaterally. Everything looks pretty good up there. Moist, pink. Any issues at all with sense of smell? All right, so we'll check out your eyes next. And I'm just gonna flip the light off real quick so that we can kind of get a better look at any vision issues. So his pupils are equally round. They react to light. Checking out cardinal fields of gaze for cranial nerves 3, 4, and 6. The oculomotor, trochlear, and abducens. Just follow my finger. There's no nystagmus that's noted there. Can you just focus maybe on that sign behind me and then look back? So he has good accommodation with his pupils coming in and dilating. We did check cranial nerve number 2 for vision with the Snellen chart that's out in the hallway. However, it's hard to do that and be in here at the same time. He came back as a 20/30 with corrected lenses. So, just checking red reflex on both left and right, and it's present, it's grossly present. I'm gonna check really close right here. So, looking at his retina, the optic cup is visible, the optic disc is crisp, the macula is just lateral and dull to the optic disc. The background is orangish red, and he does have blood vessels present in all 4 quadrants on that eye. Moving over to this side, same deal. Also, optic disc is visible, crisp, macula is lateral, background again, orange red, and vessels are present in all 4 quadrants. Whoops. If I don't kill him. If I don't kill the patient first. So, those all look decent. Looking at his ears. Tympanic membranes are visible. They're pearly gray, cone of light's visible as well. Doesn't appear to have any issues inside his ear, any earaches or anything.
No.
And on this side, same deal. Also visible. Also gray, kind of light's present on that side as well. So, in checking cranial nerve number 8, the vestibular cochlear, I'm just going to do a whisper test. Just repeat whatever I say. Heart.
Heart?
Okay. So, to do the inspection of the mouth, I know these are going to taste awful, but we're going to do it anyway. If I can just have you open your mouth. Checking the hard palate and soft palate. Everything feels normal. Insides of his mouth feel normal. Just say, So, checking cranial nerve 10, the vagus nerve, his uvula rises and falls automatically with that. Can you smile? Stick your tongue out for me. All right, so his tongue's midline, cranial nerve 7, facial, it's good, cranial nerve 12, the hypoglossal, also good. So moving through to finish up with the face, there's a light touch test. Can I have you close your eyes and tell me if you feel this?
Yes.
Okay, so light touch, there was no abnormalities noted in your mouth, his dentition is good. So moving from there, checking over, going to the thyroid and the neck. Can you swallow for me? And again. So I don't feel anything with the thyroid. It's smooth, no nodules, kind of rubbery. The cranial nerve 9 and 11, glossopharyngeal and accessory, he swallows well. There isn't really anything going on there. So in checking lymph glands, we'll do the preauricular, postauricular, occipital, coming forward, the tonsillar, submandibular, submental, going down the anterior chain, and the posterior chain, and the supraclavicular, and the infraclavicular. I don't feel anything going on really with either of those. I'm just going to palpate your carotids. Everything feels even. I'm just going to check it. If I can have you hold your breath. And there's no bruit present with that. So I'm going to ask you to breathe through your mouth. I'm going to check your lungs out in the back. And normally we would do this under the shirt, but for purposes of the video, we're just going to do it outside. Just some deep breaths in and out. So I don't really auscultate anything that's adventitious in the back. I'm just going to listen to the front real quick. If you can breathe in and out through your mouth. Front also sounds good. So while I still have you sitting up, I'm just going to check your aortic valve. If you can sort of like lean forward a little bit. Okay, I don't. Checking the pulmonic. Herbs point. Tricuspid, and mitral. All right, I don't hear anything crazy going on right now. No murmurs that I could hear. You want to throw your feet up? I'm going to lay you back. You okay with laying down?
Mm-hmm.
So, I can have you just have your arms at your side and could you bend your knees up for me? Just in doing breast exam, any nipple discharge, anything like that?
No.
Can I have you put one hand over your head? I don't notice any axillary lymph nodes that would be enlarged. On the other side, please. On either side. So, in finding the PMI, I'm gonna have to lift your stuff up. I don't really appreciate appreciate any thrill, heave. It seems to be strong and regular in that position as well. I'm going to recheck your valves while you're laying down. Can I have you sort of rotate a little bit the other direction for me? There you go. Good. All right. There's no murmurs there either. I'm gonna lay down flat, do an abdominal inspection. I didn't hear any murmurs at all, so you're good. Only S1 and S2. All right. You good there? All right. So, in auscultating the abdomen, if you can bend your knees again, tell me that it kind of makes it a little better on the sound quality. Yeah, it's good vowel sounds. Just normal peristalsis. So I don't really notice any abdominal distension at all. So just in mostly tympanic resonance. It's a little duller up by the liver. Any tenderness?
No.
Any hernias?
No.
So can you take a deep breath for me in? So the liver is within normal limits. It doesn't feel like there's too much happening there. One more time. There's no splenomegaly either, which is good. So I'm just going to do a couple deep pushes. Tell me if there's any pain associated when I let go.
No. No.
Okay. All right, so we'll switch back up. Just going to do a femoral pulse real quick while I have you there. Sorry. Those femoral pulses are... We're almost done, I promise. So, just going to do some reflexes. We'll do the bicep reflex first. And tricep reflex, which seemed to get them on that one. We'll do the other side. You stretched your arm. Sorry. Yep, and there it goes again. We'll catch your knee here. And there's a radial reflex here too. Almost good on that. Okay, so just doing a neuro check. Just if you could rapidly alternate, touching your finger to your nose. Perfect. So I'm kind of going to go out of sequence, but can you grab my hand, squeeze as hard as you can, but don't break my fingers. Push down. Okay. Push up. Good. Forward. And down. All right. So it seems that all of his muscles are within normal range of motion, strength's 5 out of 5 and symmetrical. If I need you to just walk across, maybe over to the sink and back. If you can walk. And then if you can walk on your heels coming back. Backwards on your heels. But okay. And on your toes. All right. So his neuro exam checks out. Everything looks to be pretty good. So looking, can you just shrug your shoulders up? Check an accessory, number 11 for your cranial nerve. So I believe, other than blood pressure, I'll pretty much wrap it up for the day. So let's do blood pressure real quick, now that I've made you walk around the room. Just relax your arm. $118/68. Winter chicken dinner. All right. Well, thank you, Adam. Thank you for filming.